As a global community, we've been quiet. Depression and anxiety disorders affect more than 600 million people around the world. For people suffering, everyday tasks can be difficult. So what are the roadblocks that prevent countries from addressing mental health? Stigma, inadequate funding, and poorly prepared health systems. The cost of lost productivity in the workplace due to depression and anxiety is very high too, over $1 trillion per year. But we also know that treatment for depression and anxiety is a worthwhile investment. Every dollar invested in treatment leads to a return of $4 in better health and ability to work. But governments in low-income countries spend less than 1% of their health budget on mental health. High-income countries invest around 5%. This is a critical time. Globally, only 1 in 5 people who need treatment for depression and anxiety are receiving it. Almost half of the world's poor are expected to live in a country affected by war and violence by 2030. Refugees and people living under such stressful conditions are at an even higher risk for mental health disorders. We also know that such traumatic events can have a major impact on a child's or adolescent's brain development and lasting effects on their health well into adulthood. Without action, the impact on people's mental health is likely to be on a scale we have never seen before. We can solve this by scaling up the work already underway and strengthening political will and leadership, integrating mental health into health systems, and increasing investments from national governments and international development partners. Let's bring this issue out of the shadows. It's time to make mental health a priority now.